As more patients are showing up. CBS 46's Megan Packer live for us at Piedmont Atlanta Hospital. And Megan, tell us, what's the situation there?
Well, Rick, this is one of many hospitals in our area that is diverting ambulances, asking them to take patients elsewhere if they can because of how crowded the ER and the ICU is on the other side of these walls. We have seen some ambulances show up here, but we know they're being very careful about who they take where. This all comes as the CDC reports COVID deaths nationwide are up 11% from last week.
I can't think of a single hospital in the state that is not in a critical staffing shortage need right now.
Anna Adams with the Georgia Hospital Association says hospitals across the state are struggling.
We are holding our breath in hopes that we can get additional staff down in these facilities. The help from the National Guard has been great, but we just are never going to have enough.
Earlier this week, Governor Kemp announced the Georgia National Guard and other organizations are deploying more than 100 people to more than a dozen hospitals. Piedmont Noonan specifically requested the assistance, saying they need combat medics to help with all of the COVID patients.
The hospitals, especially in South Georgia right now, have been hit incredibly hard by this latest surge. And so their staff is completely depleted from the previous surges. They've had people leave just because they don't want it, they're burnt out.
ERs and ICUs are filling up with coronavirus patients, mostly unvaccinated, on top of the patients doctors would normally be treating for other conditions. Many hospitals are having to go on diversion, meaning they're directing ambulances to go elsewhere if they can. This website tracks the level of overcrowding in ERs so EMS services know where they can get someone in.
It's difficult at this point to find a single hospital that's not on some type of diversion.
Today, 115 patients are in Grady with COVID-19. Wellstar Health System says as beds fill up with COVID patients, they may have to start to delay certain surgeries that are not urgent. And hospitals say the best thing you can do to help them out right now is to get vaccinated. And if you are not urgently sick and you need a COVID test, don't show up to the ER for that. They ask that you go somewhere else, like a community testing site. Live outside of Piedmont Hospital in Atlanta, Megan Packer, CBS 46 News.
Megan, thank you.